Welcome to Nothing Without Us, stories and discussions about meaningful inclusion. We will talk about accessibility, true inclusion, and disability justice with stories, policy updates, discussions, and related commentary on the value of being accessible and inclusive. We believe life should be accessible for everyone, and everyone should be included in all aspects of life. I am your host, Annette Bourbonnier. I am a 70-ish year old woman with short gray hair and eyeglasses. I am sitting in a power wheelchair, and my service dog Kirby could show himself at some point during the podcast. This podcast is captioned. Please press the subscribe button at any time during the podcast if you have not already done so. It will not cost you anything, but it will help us make this podcast grow. You are also welcome to make comments in the chat and to give us feedback about what you do or do not like. We especially appreciate a thumbs up. Hello, this episode of Nothing Without Us is part of our Crip the Vote series, and I am honored today to have as our guest Senator Sheldon Whitehouse. Welcome, Senator Whitehouse.
Thanks so much for having me on. I appreciate it.
Okay. So, as people know, the Crip the Vote subseries is because 20 to 25% of the U.S. population has a disability, and there are not many conversations about disability issues during campaigns or, public office holders. So this is to kind of stimulate that conversation. So I thought we should start off where we have a commonality. You're famously an advocate for the environment, and I am a person with a disability, but I'm also an environmental economist. So we have that shared thing here. So actually, the first time I met you was at a Save the Bay event too. So
Great
and
organization.
Beg your pardon?
Great organization.
Absolutely, absolutely. So I believe disability justice equals environmental justice. They are really intertwined in a lot of ways. And in preparing for something else, I came across the READY Act. The one, it was introduced in the Senate by Senator Bob Casey.
Yeah.
And what really impressed me about it, I mean, we do have to be ready for climate disasters. And oh my God, look at what's happening with the hurricanes this year. It really, really strongly brings to mind how much we need to deal with this. And this act requires the meaningful inclusion of people with disabilities in the planning for climate disasters. So a lot of people can't go to shelters, because, and we don't want to see what happened with Katrina happen, but, people like me would not do well in shelters unless it's planned for in advance. So can you talk a little bit about this act and its implications? And I'm hoping where you stand on it.
Yeah, it's you brought it to my attention, which I'm grateful that you did. Senator Casey has filed it in the Senate. There does not appear to be a House companion, and so far, no Senate Republican has sponsored the bill, but it certainly looks like a very good idea. And it's almost goes without saying that when you're planning a disaster response, you need to take into account the needs of people with disabilities and make sure that they're not overlooked and that they have access to the means of escape and refuge and recovery that are necessary to respond to the disaster. So many thanks for flagging the bill for me. We're looking at it with a view to co-sponsoring and hoping that Bob can round up some Republican co-sponsors, because that obviously is very helpful to a Republican-controlled House.
Right.
There are Republican senators on a bill.
Right, for sure. Yeah, it is important. I mean, you look, and like I said, because it requires the inclusion of us with disabilities in the planning, because who else is going to know
Yep.
best what is going to be needed in shelter and evacuation. I know there was some, FEMA, Red Cross, and actually, United Spinal Organization is also involved in some of the, recovery and assistance in the Southeast here, because the United Spinal is helping, people that need to rebuild ramps or need to, replace wheelchairs urgently and things like that. So, but yeah, if we can get in ahead of it, I think we need to. And I appreciate your willingness to support that.
Yeah, we're taking a close look at it, and unless we see bugs, I'm confident that we'll be able to
Right. Yeah.
support it.
Yeah. Both of our representatives are supporting it.
Good.
I believe
Good. And of course, speaking of representatives,
beg pardon?
speaking of representatives, just a kind word for Representative Langevin, who during his long and distinguished career representing Rhode Island in the House was such a terrific, articulate, and effective spokesperson for people with disabilities.
Yes, right. Yes, I know him actually. Well, this is Rhode Island. Who you always know somebody.
Who
Right?
doesn't?
There is some connection somewhere. Okay, yes. Okay, so two areas where you've done some work are Social Security and Medicare. And you know that the Social Security disability system was designed in the 1950s, and its policies really seem stuck in that area. Are you working on anything that will improve the system? For example, changing the entry into the system or making sure that, benefits are not so limited. Maybe raising the income limits for people that pay into Social Security. Um, one of the things that happens with the policies is limits.
Two things that I'm actively working.
Okay. Did I lose you?
Two things that I'm working on are, first of all, making sure that Social Security, including its SSDI component, are sound and fiscally stable for as far as the eye can see. I've got legislation that would do that. It's had a hearing in the Budget Committee, which I chair. We've talked about it repeatedly with the Office of Management and Budget and the Biden administration. And I think people in the Democratic Party anywhere are committed to shoring up both Social Security and Medicare on a more or less permanent basis, at least as far as the eye can see, and using additional tax revenues to do that. And that's the basic model. So I'm working hard to get that to be an important piece of legislation that we can push for in the Democratic caucus and over on the House side as well. And then the second is dealing with the strange things that happen when you hit fiscal cliffs, where suddenly you hit a particular number and there's a catastrophic effect on benefits. And this was provoked by a story from a young disabled Rhode Islander who works at a grocery store where she is a very popular and well-regarded member of that store's workforce and the community of shoppers there. And when there was a workforce shortage, she stepped up to provide additional hours to be a good soldier and help the operation continue to be able to serve its customers, but inadvertently put herself over the income limit for her SSDI, which caused a complete collapse of her benefits, unbeknownst to her. And then when that got caught and she was penalized for it, that came as a surprise also, because the whole thing was unintentional and unexpected. So I've talked to Chairman Wyden of the Finance Committee about what I call cliff smoothing, so that there aren't such harsh and immediate benefits for cuts for one additional dollar of income particularly when there's absolutely no indication of this being a deliberate effort to defraud the system. So those are the two things, for want of a better phrase, cliff smoothing, and also simply making sure that the Social Security and Medicare programs are viable into the indefinite future.
Right. The story you tell is one that I have experienced and many people that I know have experienced.
Yeah,
And being an economist, if people with disabilities are allowed to work and earn what they're capable of earning, we're paying taxes. We're paying more taxes. And when we're paying taxes, we are, buying also goods and services. So it's basic economic driver. Where if you put limits on it, first of all, it creates an enormous stress on us
yeah,
because we're always worried about that limit, and it's an arbitrary limit.
yeah,
Uh, Poverty levels were never intended to be a target. They were intended to be a measure, but we use them as a target. You cross that threshold, boom, we pull the rug out from under you. Okay, we want you to work, but we're not going to let you. It is how it works. And this is me talking from experience as well as an economist. And that is a perversity in the law that I mean, I guess everybody's always worried we're cheating the system, but I'm willing to bet you're going to find a whole lot more tax cheats than you are going to find people cheating Social Security or
yeah. And
Medicare.
if you want to look for people who are cheating on Uncle Sam, the idea that a low income person with disabilities should be your target rather than a mega corporation with a fake offshore headquarters or some creepy billionaire who pays no taxes at all, that's kind of pretty rotten priorities.
That's it, yeah, and that's what we really need to change. I mean, I see people who are always being stymied by income limits. I mean, it's too late to change things for me. I'm even older than you are, but
Yeah,
not that you're
it also implies that somebody's on a regular salary payroll
right,
wage earner that is predictable and constant. But as
right,
we move into a gig economy and as people take more seasonal work
yeah,
and wages can fluctuate, you could have a fluctuation that puts you over the top that may not be permanent at all. But you would
exactly,
like you want people to earn to the limits of their capacity. You want people to do the
right,
best for themselves, and
right,
discouraging that in case inadvertently you should go over it, so you stay under it by a safety margin. It is not good policy. You
no,
as an economist will know.
right, exactly. And it's very stressful too. It is a stress that adds to, I mean, you're already balancing how much you can function as a person with a disability, and then to have that stress of, oh my God, if I cross that, I'm going to lose my Medicaid or I'm going to lose, Social Security or something, which can
Yeah.
be a real disaster. So, and it can take months to clear up.
Yes,
Yeah,
that too is a problem. Unwinding it is a
right.
mess. One of the
It is.
reasons we got became aware of that case is because the individual's father contacted us because
Yeah,
unsorting it was such a mess for them. So our constituent
exactly.
services team kicked in to help resolve the
Right.
issue. But clearly, if you have to go to a senator's constituent services team to help resolve the issue, it is not an easy to resolve issue, and it should be.
Right. Exactly. So I'm going to talk a little bit about Medicare for All. It sounds good to a lot of people. Some of the, in order to do that, I believe in a single payer, by the way, so I'm not trying to defeat that. But Medicare comes with a lot of significant hindrances for people receiving health care if there are any chronic diseases or disabilities. And I believe I gave some examples of the issues that happen with durable medical equipment.
Yeah.
So the Center for Medicare and Medicaid, they contract, they're the people that run Medicare. They contract with only a certain number of providers in each state to provide certain durable medical equipment. And one of the things that has happened because of this is it has actually driven the prices up, which is kind of scary, especially if somebody has to make their own copays. A wheelchair that used to cost $30,000 now costs almost $78,000. Well, costs $78,000, and that's in a period of, like 10 or 11 years. That's a big jump.
Yeah.
And if you have to meet those copays, you're really in trouble. But the other part of it is because they've limited to only a couple of very big companies, there's no motivation for service. The big companies don't maintain a regular, a large enough fleet of service technicians. And people sometimes go months waiting for a wheelchair to get repaired, or replaced. And this is not just here in Rhode Island. This is, all over the country because these big companies do business in almost all the states. I think that's something that, we need to look at a way of making it more competitive again. When we had a lot of vendors here, we used to get really good service. So I think that we need to be, interject a little more in competitiveness in there.
Yeah, it's a good point.
Can we address some of that? Is there a way we can get some of that in there?
I will gladly look at any proposal.
Right.
We've been focusing mostly on the problem of prior authorizations,
Oh, yes.
which very often interfere with people's treatment and people's payments.
Right.
And it seems to fall particularly hard in the Medicare disability insurance population compared to Medicare generally. There's much more
Right.
dissatisfaction with the program, with people
Right.
getting Medicare disability insurance than regular Medicare protections.
Right.
So we're looking at that. I'm working on a bill that basically says if you're a Medicare Advantage provider, you don't get to do prior authorizations without prior authorization. So that if you think a prior authorization is really necessary for your patients, we'll go to CMS and get their approval for that. So you're not just using it to squeeze more profits and more money out of the marketplace by creating massive inconveniences that prior authorizations cause. So we're trying to get some good bipartisan support for that and try to get that into perhaps a finance committee, Medicare bipartisan reform bill. So we're working on that, but the prior authorizations have gotten completely out of control. And particularly when you have doctors in Rhode Island who are in what's called, the accountable care organizations like Coastal and Integra, the big primary care provider groups.
Right.
When they lose money on a patient, they lose money. It doesn't make sense for them to run up bills or run up equipment expenditures in order to make more money the way it does under fee-for-service. So the interests are aligned with the program, and to cause their patients to have to face prior authorization really doesn't make sense at all. So that's a program that I think could be very helpful if we can get it passed. And people really hate prior authorizations, and they've been legendarily abused by the insurance industry.
Well, yeah, they are, because first of all, most of the time the insurance company is already, determined that the person requires it. So why should they have another prior every year? Or if they've bought the equipment, why do they need a prior to fix it? Protect your investment, just let it be fixed. But it also has the effect, you talk about those physicians. We really have a shortage of primary care physicians, not just in Rhode Island, but and we use them for stupid things and using up their time that way.
Yeah, it's a big time waste. And it's a big time waste at the insurance companies too, except that they are able to hold off payments or even
Right.
just get people have discouraged, people get discouraged and give up, so they then make the money. But that's
Right.
no way to run an insurance company. That's not the proper way to run an insurance company.
No, it's not. And again, it creates significant delays for the individuals, people with chronic health problems and people with disabilities. Um, there are just so many hurdles.
Yeah, not to mention a huge hassle in their
Right,
lives.
right, exactly, exactly. And I'm not going to do more than just plant a seed on. Another thing is maybe in the future we should look at the issue of corporate healthcare, large hospital systems owning medical practices, and what that does to patient care. Unfortunately, it's not what they promote. But I'm not going to. I haven't really put that on, but we should plant that seed for a
Just
future
to let you
discussion.
know,
What do you
that
think?
is on my radar as well, in
Okay,
particular because Coastal Medical, as an independent primary care provider group, a group of doctors dealing with
right,
their patients,
right.
was among the best in the country,
Mm-hmm.
championship performer
Right,
among the accountable care organizations. And then
right,
it merged into Lifespan. And when it merged into Lifespan, the decision making became more complicated. The corporate culture changed a bit,
mm-hmm.
and they slipped away from their really extraordinary leadership position. So I'm watching that because I don't like to see a Rhode Island organization slip from, best in country. And so we are watching that. That is on my radar screen. That's a really terrific point.
Okay, well, maybe in the future, when you're not running for office and as tight on time, we can have a discussion about that as well.
Let's do it. And I'll be more alert to the question you also raised about creating more competition for durable medical equipment and durable medical equipment
Right,
repairs, so that competition brings some oxygen into that market, some lower prices and quicker service.
right. And that's actually going to be I think, the real answer with the whole corporate healthcare as well. I think that hospital systems should not be owning medical practices and let the medical practices be affiliated, but not necessarily owned. And I think we'll have better, again, it would increase competition and provide better service.
Yeah, well, the ongoing experiment in Rhode Island with Coastal Medical before Lifespan and now within Lifespan, and
Right,
seeing which way they turn now that they're within Lifespan, is a true case in point for that.
right. Well, that'd be interesting. I hope somebody's doing an evaluation, an economic evaluation of it. Mhm.
We are definitely watching it.
Okay, good. Thank you. Well, I do thank you very much for your time, Senator Whitehouse. Before we end this podcast, I want to remind people that the southeast portion of our country was seriously, catastrophically injured by two hurricanes, Milton and Helene. It is bad for everyone. My heart goes out to everybody who's lost property, lives, and has just been so disruptive. But it's also a significant problem for people with disabilities who may not have a good way to access the things that they need. I'm going to again put in the notes here the links for United Spinal, who was working on getting wheelchairs and ramps and similar equipment, making it available and helping those in need of it. And also to the Red Cross. I know FEMA is doing its job where everybody needs to pitch in whatever you can. I also want to add that this year, more than ever, it is so important that you go out and vote. Whether you're voting by mail, voting early voting, or going out to the polls on November 5th, please vote. Our democracy depends on it. Things are really scary right now, and we need everybody to do their part. It is our power, and this power, this right and obligation that we have should not be put aside. This year, more than ever, we need to do this. So this is Annette Bourbonniere. Thank you for listening. I'm Annette from Nothing Without Us, Stories and Discussions of Meaningful Inclusion. Please tell your friends to look for us on patreon.com and on YouTube. Give us a thumbs up. Make some comments. It will help this podcast grow. And that's what we'd like to do from now on. I want to get the word out to a lot of people. I have some very interesting topics coming up in the near future, but we want to get through anybody that's willing to talk on camera during the election season. We'll get a priority right now, but we do have some others coming up that are going to be very, very interesting as well. So till the next Nothing Without Us, this is Annette Bourbonniere.